Brain aneurysms can be extremely serious, and fast diagnosis and proper treatment are critical. An estimated 6 million people in the United States, that's 1 in 50, have an unruptured brain aneurysm. About 1 in 10,000 of these will rupture this year. Terri Lomax, a 56-year-old living in High Ridge, is one of those people.
It was on a Saturday morning, and I was helping my husband lift a couch. And when I did that, I felt something pop or something in my head. It was a weird feeling, and I automatically got a really bad headache, and I got dizzy. I was off on Sunday, but then I went to work on Monday and Tuesday with this headache, and then I started getting nausea. And I went to the doctor on Wednesday, and they treated me for a viral infection, so they gave me some nausea medication, which did not help. The headache kept getting so severe, I decided to go on into the emergency room over at St. Clare. And when I went in, the emergency room doctor, I was telling him all the symptoms that I had, which the headache was the worst part, I think. And he had me go do a CT scan, and I had that done. And then when we got the results back, he came back in and told me that it was a brain aneurysm.
Dr. Armond Levy is Terri's neurosurgeon and neuro-interventionist. He emphasizes the importance of quick and correct treatment for a ruptured aneurysm.
An aneurysm, in its simplest definition, is really kind of a ballooning or a weakening of the wall of an artery, kind of like you might see on the wall of a tire if it kind of balloons out and gets weak. A ruptured aneurysm, we always used to say during residency, is one of the worst things that can happen to a human body. It has a cascade of effects that really ripples throughout the entire human physiology. Essentially what happens is blood leaks out under arterial pressure, which is very high pressure, into the space underneath and around the brain. Having arterialized blood there is extraordinarily irritating to the brain and to the blood vessels around the brain. It causes all the blood vessels around the brain to constrict suddenly. It's the body's way of trying to cause the bleeding to stop. But what that does, if all the blood vessels around the brain constrict suddenly, is it can kind of cause a stroke, a global stroke throughout the entire brain.
The specific causes of brain aneurysms are not known, but some theories include risk factors such as family history, high blood pressure, smoking, heavy drug or alcohol use, and head trauma. Older people, African Americans, and women seem to be at a higher risk. Aneurysms can be very difficult to detect, especially if they haven't ruptured.
A decent percentage of people that come into our office present with aneurysms that have no symptoms at all. But we do occasionally see those sorts of things where an aneurysm becomes symptomatic before it ruptures, and those are considered emergencies. The other end of the spectrum is people who've had a ruptured aneurysm when it's a catastrophic presentation, worst headache of the life, coma, seizure, death, paralysis, all the sorts of things you might expect from a stroke and then some, just a horrible, horrible event.
There are a number of ways to detect an aneurysm.
Sometimes CT scans with special kinds of contrast dye are performed in the hospital to evaluate for an aneurysm. Sometimes MRIs with contrast and special imaging sequences on MRIs are used to see aneurysms. The ultimate test really to see an aneurysm is to do an arteriogram if you have a high suspicion.
After the CT scan, they wanted to do a spinal tap on me to see if any of the blood had leaked into my spine. When they did that and they did the spinal tap, that's when they decided it had leaked and ruptured, and that's when they called Dr. Levy in to do the surgery.
The two primary methods of treating an aneurysm are clipping and coiling. With clipping, the neurosurgeon removes a flap of skull to provide access. The clip is placed at the base of the aneurysm, closing it off. Coiling is an endovascular procedure, meaning it is done from within the blood vessels. Tiny platinum wires, or coils, are pushed into the aneurysm through a catheter inserted in an artery in the groin up to the site in the brain. The wires fill the aneurysm and cause a clot to form inside the aneurysm, sealing it off.
We are equipped as well as any top-flight academic center could be. There is really essentially nothing that we cannot do in terms of treating an aneurysm.
So after the surgery, I was in the hospital from Friday to Friday. During that week, I did a little bit of therapy. I know I'm a very lucky girl to have survived a ruptured brain aneurysm. I feel like I'm really lucky that I had Dr. Levy doing the surgery because he was very good. I haven't had any headaches. I haven't had any nausea or anything since I've been home. I Once in a while I get a little dizzy, but I think I just jump up too quick. But I actually feel great. I feel like I got really good care, and I felt like I had the best doctor in Dr. Levy. I would just like everyone to know that the care I got at St. Clare Hospital in Fenton was outstanding. The whole staff, the entire staff that took care of me were excellent. All the nurses, everybody. They gave 110% every day.
To connect with an SSM neurosurgeon, call 1-866-SSM-DOCS.